Hello, thank you for joining us. We are about to start our graduation ceremony. We would ask you to remain on mute until you receive notice to take your computer off mute. Good morning, everyone. My name is Mercedes Washington, the manager trainer of the HealthWorks program at JVS SoCal. Today, I am very happy to welcome you to our CareerWorks Medical graduation. For those of you who are unfamiliar with JVS SoCal, we are a nonprofit agency approaching our 90th anniversary. We have been offering hope and opportunity to our diverse Southern California community since 1939. Many things have changed since our founding, but our mission remains the same: building better lives, one job at a time, by empowering individuals to achieve dignity and economic independence through sustainable employment. And now, a special message to our employer partners and sponsors.
Thank you, Mercedes. Hi, I'm Neil Mendelsohn, and I'm the Chief Strategy Officer at JVS SoCal. I'd like to take this opportunity to thank all of the employer partners and funders that support the CareerWorks Medical Career Training Program. CareerWorks Medical funding partners include Children's Hospital Los Angeles, Cedars-Sinai Medical Center, RadNet, Bank of California, Union Bank, Comerica Bank, CIT One West Bank, Home Street Bank, Pacific Western Bank, Wells Fargo Bank, the Sherry and Les Biller Family Foundation, the Michael and Irene Ross Endowment Fund, the Deutsch Foundation, the James Irvine Foundation, the William Randolph Hearst Foundations, the Ralph M. Parsons Foundation, the Pfaffinger Foundation, the State of California Employment Training Panel, and the JVS Women's Leadership Network. We'd also like to thank our friends and partners at CareerWorks National for their enduring support and guidance. We're grateful for all of your support. You make our life-changing programs and services possible. I'm also pleased to acknowledge the following employers present with us today: RadNet, Cedars-Sinai Medical Center, Children's Hospital Los Angeles, Altamed, and LA Care. We have a number of our board members present. Please welcome Rick Powell, Harris Smith, and Robert Pearman. Forgive me if I've missed anybody. We're also joined today by JVS SoCal executives and program directors, including Ted Feldman, Perrine Mann, Jody Doan, Diane Shapiro, Randy Lappin, and Jay Soloway. A big shout out to the entire JVS Works team for the great work you do every day and for making our career training programs successful. Finally, and most important, here's to our graduates. Congratulations and good luck in your new careers. And now it's my honor to introduce ELISE LEVINE, whose leadership and tireless commitment empowers our CareerWorks Medical students to succeed in their new healthcare careers. ELISE, take it away.
Good morning, everyone. Thank you for joining us for our first virtual CareerWorks Medical graduation. Before we get started, for those familiar with Zoom, please feel free to use the chat feature to send messages of congratulations to our graduates, and also feel free to use the reaction buttons to cheer on our graduates. We're recording this graduation and we will be sharing your well wishes with our graduates following the event. Beginning in November of 2019, through a partnership with the Sherry and Les Biller Foundation, JVS SoCal CareerWorks Medical program offered their first class, training participants for non-clinical positions in the healthcare industry. With their support, along with our other generous donors and community partners, we can offer programs like CareerWorks Medical at no cost to our participants. While the training is rigorous and effective, CareerWorks Medical is much more than just training. We partner with community employers who are committed to providing full-time jobs with a living wage and benefits, as well as the potential for career growth. We believe CareerWorks Medical is uniquely successful for these reasons. We attract students from all walks of life and diverse backgrounds with diverse job interests. We work closely with our hiring partners throughout the 8-week program, in most cases having talent acquisition teams coming right to our classroom, or for right now, our Zooms, and they meet with the students. They get their questions answered, and they get an idea of opportunities post-graduation. I'd especially like to thank Children's Hospital, RadNet, and Cedars-Sinai for joining our classes during this cohort. If you're an employer that's here today and you didn't come to classes this cohort and would like to come to our next one, please reach out to me. We would love to have you. We not only work closely with the students to provide this training and help make those job matches, but we commit to a year of follow-up coaching and assistance to enhance retention, which benefits everyone. We take advantage of all available tools to continue our relationship by conducting an in-depth LinkedIn training. Our students graduate with updated live profiles, which not only keep them connected to JVS SoCal, but also connect them to the healthcare world to become excellent networkers. Because CareerWorks Medical can place students in a variety of positions in healthcare, we use tools such as the Myers-Briggs personality test to help students learn more about themselves and others, and to see beyond what they might have thought were possibilities for them. With the help of our generous funders, we've been able to be nimble during these times, ensuring student safety by offering a blended learning environment and implementing an online learning management system to ensure classes can take place no matter what. In addition to the wonderful CareerWorks Medical coursework, we've added modules on digital citizenship, aging sensitivity, dementia sensitivity, and disability sensitivity to be in step with current needs in the healthcare community. We're responsive to our employers and are looking for unique ways to better prepare our students. We've heard from a number of our employer partners that medical terminology certification or experience is important. We were able to, with the gracious support of a donor, provide students with an additional online medical terminology certification course through the Des Moines University of Health Sciences and Medicine. This will better prepare and make these students even more marketable. None of this would be possible without the support of the Sherry and Les Biller Family Foundation. We're fortunate that Sherry and Les are able to join us this morning, or at least I've seen Les. I'm not sure if Sherry is able to make it. I hope so. In 2001, as he completed a 30-year career in the banking industry with senior leadership positions at some of the world's premier financial institutions, Les Biller began a new philanthropic role as a founding director of the Sherry and Les Biller Family Foundation. A collaborative venture with his wife, Sherry, the foundation structure enables the Billers to be partners in effecting change and ensuring those changes are sustainable. The foundation collaborates with organizations to create innovative and scalable program models in the areas of public education, supportive care, theater enrichment, and career pathways, striving for impact in communities of color and areas of high poverty by focusing its efforts on equity and access. Les's active engagement in the foundation resulted in its flagship career pathways program, BankWorks, which launches careers in the banking industry with customized job training, placement assistance, and ongoing coaching, and has now been replicated with CareerWorks Medical, which is training students and placing graduates in non-clinical medical careers. Ladies and gentlemen, please welcome the founder of CareerWorks Medical, Mr. Les Biller.
Good morning. It's strange to be sitting in my office at home and talking to you all via Zoom, but it is the times that we're living in. I want to congratulate all the graduates first and foremost. I know how hard you work to get here, and especially during these difficult periods that we're all living through. I want to also extend my congratulations to your family and friends who have supported you as you've gone through this rigorous training process. And thank all of the employers who are here at the graduation and will be at the job fair. This program could not exist without those employer partners. You know, in a normal year, well, I'll call a non-COVID year, I typically attend about a dozen of these graduations all across the country. I really look forward to meeting all the graduates and always show up early before the graduation ceremony so I can get a chance to talk to all of you, hear about your life stories and the path that you've taken to get here and the challenges that you've overcome. When I do that, and I do that in person, I'm always dressed in a suit and a tie out of respect for all of you as graduates. and also out of respect for the achievement that the graduation symbolizes. So today I put on a suit and tie, and I'll admit to you, it's the first time I've put on a suit and tie since COVID struck, because I wanted to make it very clear to you how much I respect you for all the hard work that you've gone through and the importance this graduation represents. Now, during my business career, there were several times during it where individuals that I worked with took an interest in me and opened a door for me by giving me an opportunity for a promotion or to lead a special corporate initiative. They could have given that opportunity to anyone, but they decided to give it to me. That was something I couldn't control. But what I could control was the kind of job I did once they gave me that opportunity, how hard I worked, and the results that I achieved. Now, each of you have gone through a screening process that was designed by the employers to select individuals that they thought would uniquely be effective within their organizations. And the curriculum you've just gone through and studied was designed by those employers to make sure that it gave you all of the knowledge and skills that they believed would be essential to your success once you join the company. That's why our graduates tend to be so successful. They're hired in high percentages by the employers, and most importantly, they're recognized and rewarded with promotions more quickly than other people they hire in the market in general. Now, I'm looking forward to a day post-COVID when you and I can meet in person, where you're coming back to a future graduation as a returning graduate to tell the story of how this program has changed your life for the better. And I'll be there to share this same story that I'm sharing with you today with that class. Until then, let me wish you all the best. I know you're gonna do great in your job fair later today. And I know you're gonna be successful once you start working in the beginning of a truly outstanding career. So best of luck. Thank you very much. Speak to you soon.
Thank you, Les. Your words are always inspiring, and I too look forward to the day where we can see each other in person and get to have you talk to the graduates and the returning alumni. Now is the moment that we've all been waiting for, the presentation of our graduates to you, family, friends, and employer partners. So we will begin with Laura BEHARY. Laura came to the CareerWorks Medical program after a long history as an assistant editor in the motion picture industry. As changes occurred in the entertainment industry, Laura was faced with a complete change in career. With a previous bachelor's degree in film in hand, she took advantage of a training offered through the AJCC and received a certification as a human resources assistant. She then found the CareerWorks Medical program and realized she could combine her newfound interest in HR with healthcare. Laura has the empathetic, caring heart that's needed in healthcare. Laura and her family are what I call a double foster family. They foster both children and animals in their home for nurturing and care when they are at their most vulnerable. Laura's looking for that opportunity to get her foot in the door. She would make a great HR assistant, project coordinator, or she would excel in any patient-facing position. She's eager to learn and would be an asset to any organization. While Laura may have left her Tinseltown career behind, she's ready for a starring role in healthcare. Laura BEHARY. Next is Hector Escobar. While everyone in this class has been extremely resilient, I think his classmates would agree that Hector really set an amazing example. Hector persevered through this class while dealing with some personal tragedies, and not only kept up with everything, but stayed a week ahead in his coursework to ensure he didn't fall behind, while always offering help to his fellow students. He was even here this morning, almost an hour prior to graduation. Hector's background has been in hospital nutrition services, and he's also pursuing a degree in computer sciences that he hopes can translate to healthcare. Hector's leadership abilities, healthcare knowledge, and kind personality will benefit any company he joins. Whether Hector is helping prepare meal plans for patients or getting his foot in the door in healthcare IT, you can't go wrong with Hector joining your team. Next is Bridgette Frazier. Bridgette comes to CareerWorks Medical also with a bachelor's degree, but hers is in sociology and social work, and she has spent her career working with troubled youth and in special education. For anyone who knows anything about residential treatment centers like where Bridgette works, one must have a special heart for this work, and if you can be successful in it, you can do anything. Bridgette's now looking for the next step in her career and would like to start down a new path in healthcare. And if she can make use of her education and previous work experiences, even better. Bridgette was known in class for asking the questions in the very best way. She's inquisitive and is eager to learn in her new career in healthcare. No matter where she lands, she will be an incredible asset to your organization. Erendira GUZMAN. Erendira, or Ere, but I like to practice Erendira because I can't roll my R's very well. She came to our class with a plan. She knows what she wants to do and has done all of the research to get there. Her dream is to become a certified surgical technologist. However, after spending many years as the assistant manager at the bagel factory, she is willing to take the time and the steps needed to learn healthcare from the ground up while she pursues her dream. She has leadership experience, operations experience, and I would recommend her for anything. While her goal at this point upon her path is to get her certification in sterile processing, she's a realist. She's also someone who's completed a marathon, so she knows that you have to work up to 26.2 miles. You don't get there overnight. Erendira is definitely not starting with a 5K. Her experience puts her more at a 10K or a half marathon, and you will not be sorry having her on your team. Nelson Melgar recently completed his associate's degree at West LA College in Business and hopes to go to Cal State Fullerton next year in their evening business program. In addition, he has an administrative assistant certificate. He has worked as a night host at a large residential community for the past 5 years, providing excellent customer service to the over 300 units and their tenants. Nelson's long-term goal is to be in management, but at this time he is looking to get his foot in the door and work in healthcare as he finishes his degree in business. Elizabeth Mendez is also currently in college, and she has a dream to not only be the first in her family to finish her bachelor's degree, she has a long-term goal of becoming a lawyer, perhaps even in healthcare. Elizabeth comes with an administrative experience supporting a CEO, as well as working in quality control in the nutraceutical industry. Elizabeth hopes to work in healthcare in an administrative position, using her skills to support an organization. Working in quality control has given her a keen eye for detail, and she'd be the perfect person to cross your T's and dot your I's. JOCELYN VELAZQUEZ is the bubbly and energetic person you want answering your phones or working the front desk. She's a people person and loves to go out of her way to ensure patient satisfaction. She has worked in a number of customer service roles, and with myself having personally managed medical clinics, she's the person that I would want to talk to patients. We all know that patient satisfaction is a key measure in healthcare these days, and JOCELYN is someone who will ensure your 5-star ratings. And last but not least, SHIRLEY VIELMAN. SHIRLEY comes to us with a bachelor's in communications from Woodbury University. I personally admire SHIRLEY because out of college, instead of jumping into the first job that came her way, she took the option of long-term temping in a variety of situations, which has given her a well-rounded background and an idea of where her passions lie. SHIRLEY has supported C-suite executives professionally and personally, and her most recent positions were at Cedars-Sinai as an HR temp, and prior to that at St. John's Hospital working as a project coordinator in the engineering department. SHIRLEY understands things like accreditation surveys and hospital operations. While her long-term goal is to get into hospital philanthropy, she wants to settle in a more permanent position and begin a career that leads to her goals. That concludes our graduates. So if you would now please unmute your microphones and recognize the 3rd graduating class of JVS SoCal CareerWorks Medical Program.
Hey, bravo.
Congratulations.
You guys rock.
Nice job.
Thank you, everybody. So to the graduates, I just want to say that it was an honor and a pleasure to get to know you and have you in this cohort. We've spent these past 8 weeks getting to know each other, preparing for your next career steps, and creating our network for the future. The rest of the JVS SoCal team and I will be there to provide support and guidance to create meaningful changes in your life. We just simply ask you to pay it forward by staying connected to us. You're a part of our family now. And CareerWorks Medical 3 was our first blended learning class. I applaud all of you. We have seen students face personal challenges as well as pandemic challenges. Regardless, you were committed, enthusiastic, and it's with pride that I can recommend you as employees in your new careers. You've been invaluable to me by being the first students to use our online portal. You've made suggestions and given feedback that I genuinely appreciate. You make this program better and better with every cohort. And in closing, I just want to thank everyone for joining us for this milestone event as we help our graduates launch new careers and build better futures for themselves and their families. CareerWorks Medical is the perfect illustration of this is a tongue twister, the public-private philanthropic and nonprofit partnership. By combining our resources and expertise, we have the power to change lives. No single one of us can do it alone, but this program does demonstrate what we can do together. The commitment to support those in need in our community is shared by every one of our employer partners here today, our foundation supporters, and our donors. On behalf of the people we serve, I thank each one of you for doing everything that you do to help us achieve our mission. And if I may address my remarks to the employers online for a moment, that partnership, as evidenced here this morning, produces something both you and JVS SoCal want to see. Viable, vetted, highly motivated, well-trained, and ready to go candidates for your workforce. Our graduates are ready to work. They have already begun the job search by creating their accounts with our employer partners. Some of them are interviewing already. And if I haven't been in contact with you already with the jobs that they're applying for, you will be hearing from me in the next few days. In addition, if you know of any entry-level needs that may not have been made public yet, reach out to me so I can help you fill those positions. To our graduates, I say this: we ask you to pay it forward by staying connected to the CareerWorks Medical team. We want to hear about your challenges as well as your career opportunities and the future promotions that we know are ahead of you. You have my phone number, my email, and my LinkedIn, and I have yours. I have no doubt we will stay connected. And just remember the two things that I told you in the very beginning: trust the process, and what's meant for you won't miss you. We rely on you two to be our JVS SoCal ambassadors, talking up the program, encouraging those you know to apply to any of our offerings. You too can help change someone's life. And now for a few announcements. Don't forget to like us, follow us, and share your experiences on social media so you can help us spread the word about this amazing program. We are now concluding our program. We are not holding our traditional job fair as our students have already been engaged with many of our employers. Again, employers, please reach out to me to connect you to any of our graduates. Thank you again and have a wonderful day. You can unmute your mics and we can, again, congratulate our graduates. Thank you.
Congratulations.
Yay.
Yay!
Go get those jobs.
Get those jobs.
You did it.
Yes, we did it.
Congrats.
Great, great.
Stay
Matt?
healthy, everyone. Bye-bye.